I've always worked in healthcare in some way, shape, or form. Early on, before I even became a nurse, I used to work for the county for WIC, Family Case Management, and I used to go out into the community and I would do visits on at-risk women and children. So I kind of started out with the love for being in the field even before I became a nurse. And as I was doing that job, I realized nursing is what I wanted to do. So I ended up leaving that job, going back, getting my nursing degree, to gain experience as one nurse does. I went into the acute care setting. I worked on the floor as a floor nurse. I worked at Central DuPage in Winfield, and I was in the ICU for 7 years. Definitely my first love, but I always knew I wanted to go back and get my nurse practitioner, and I always knew that I wanted to go back and work into the community, specifically the Spanish-speaking community, because I am bilingual, Mexican heritage, and after I graduated and got my MP, my first job as an MP was in house calls. And I've been doing house calls pretty much ever since. So what I love about house calls is it's truly unique. You know, taking care of patients in their homes, out in the field, in their own environment, it's fun. It's the most challenging work, but also the most rewarding. You're taking care of the most complicated, sickest of the sick patients. You're taking care of patients that can't get out anymore, have physical, mental disabilities. But the relationships that you start to have with the patients and their family cannot be surpassed. It's relationships that I don't think you could ever establish in a clinic or in the hospital, because you are integrated into their world. You are in their home. You almost become sometimes like a member of their family. I have patients' homes who I go into where the trust, has been built up so much that I just know where the medicine cabinet is. I just look in their cabinets. It's like kind of a routine. It's just the relationships that you build, the care that you're able to give is unlike anything I've ever seen before. I mean, I could definitely think of a few, but the one that pops into my head is one of my patients. She is in her mid 80s. She lives in a senior apartment. So it's not assisted living, it's not a nursing home. She lives independently by herself. So her goal is to stay there. And so by bringing in home care physicians, we've helped her stay uh, in her home, where she's most comfortable. We've been able to prepackage her medicines. We've been able to bring in case management to help with transportation so that she can get to the follow-up appointments that she needs to get to. She was a high ER user before home care physicians came in. And since, I would say in the last year, she has gone to the hospital maybe twice. The relationship that we've built, there's a lot of trust. I say it would almost feel like, like family.